And we're back now with Sunday House Calls. Research linking sleep deprivation in physicians to reduce performance is now being challenged. The new Canadian study says that patients who receive common operations in the daytime, well, they claim they fare no worse in the short term if the physician worked that hospital graveyard overnight shift the night before than patients whose doctor did not. So, Dr. Siegel, does this make sense to you?
Well, first of all, it's a first of its kind study. And it looked at almost 40,000 patients in Ontario and almost 1,500 physicians. And it looked at one day. You know, your doctor that day had the graveyard shift from 12 to 7. And the next day he had an elective procedure like a hip replacement or a knee replacement or spinal surgery. How did he or she do? Well, the complication rate was not greater even if the surgeon worked overnight. No, death rate was not higher. And readmission rate was not higher. But Eric, the author of the study, points out these are not trainees. We're talking about attending surgeons like Dr. Samadi here, people who have experience, people who also have control over their schedule, who could say, I want to take a break in between surgery. I want to spread that out. It's a really surprising finding, but I think it's very, very informative. And I would ask Dr. Samadi whether it matters. I want to ask him one quick question.
Dr. Samadi does 1 billion operations. I mean, what do you do?
Well, look, for number one, you have to be very honest with your patients. And if you don't feel good or if you're tired and you've had some trauma or something that happened the night before, and you have to tell them. And this has happened to me. A few years ago, I remember I actually went up to my patient. It just happened that he was a gynecologist. And I said, today is not a good day. I don't feel good, and I'm not going to perform your operation. And they respect you more. When you're honest with your patient and you tell them the truth. Of course, at the beginning, he was upset because he was all psyched up for the surgery, but it turns out that not only he did amazingly well, we still laugh about that moment, and he's doing very well. This study is important because years ago, the same thing happened to the residents and fellows that stay overnight. They weren't doing so well, so there were more complications. And the Office of Graduate Medical Office basically said you can only work for 24 hours, and you only work for 80 hours a week and you go home. That's what happens to our residency program today. If they're at night working, the next day they go home. This particular study from Canada, about 40,000 patients, 1,400 doctors, is for doctors, attendings, where you can actually, Eric, say, you know what, I don't feel good today, I'm going to change my schedule so you have more control. Basically, the message to a lot of patients is when you interview your surgeon, find out does he have his own team? Does he have his own anesthesiologist? When you do a lot of these cases all the time, like for example, last week I had 15 major surgeries. That's a lot of surgeries. So your body, just like being in the Army, as a surgeon, your body gets used to it. You build up the stamina.
A couple of points. We train as doctors to be a little bit on the sleep-deprived side and still do our best, but we're not talking about chronic sleep deprivation here. Nobody's recommending, and the author of this study was clear, nobody's recommending that surgeons get 4 hours of sleep a night on a regular basis. Regular sleep is important to any profession. Absolutely. Pilots, train operators, surgeons. But if you happen to have one night where you worked the night before and you're a surgeon that has done a lot of the same operation over and over, it seems like at least the short-term outcome is just as good.
Yes.
You always try, and you do this as a surgeon for your patients. You always get your 6-7 hours of sleep, but your body, you're right, this is a very good point. Your body gets used to it, and you can perform.
Well, I like to go in. If you have an operation, do it like early in the morning, because I think the doctor just woke up like 2 hours before, and he's most wide awake at like 7 in the morning.
No, don't put it out there, because a lot of patients are going to say, I want the morning one. It really depends on your surgeon and how good he is, and usually the afternoon surgery and morning is basically the same.
I asked Dr.
Also,
Samadi
play the music. You remember we talked about it last week?
I asked you that, and you said your afternoon operations are just as good as your morning ones, but I think the music is part of it.
He can do it with put a blindfold on.